advocate for care for undocumented patients, which is an issue close to our hearts, especially as we learn more about the complexities of healthcare close to the US-Mexico border. Here is the mission statement we created. Understanding that this issue is complex and multifaceted, our group chose to focus our advocacy efforts on informing the greater Tucson community, which is highly diverse. By informing the public of the detrimental effects that a lack of healthcare access for undocumented community members has on our community as a whole, both financially and socially, we hope to add to the growing conversation on health disparities and why it is important to address them. Our research indicated many barriers to care specific to undocumented immigrants. The exclusion of undocumented individuals from resources such as Medicare, non-emergency Medicaid, CHIP, and the Affordable Care Act can lead to difficulties for these patients to seek healthcare services on a regular basis, and too often leads to the need for emergent care through EMTALA. Other barriers to care include the difficulty of navigating a complex medical system, a language barrier, and fear of discrimination or even deportation. It is clear in the literature that providing increased access to this care could have a myriad of benefits, including financial, since less emergent care would be sought if preventative and regular medical checkups were available, and could have many public health benefits. One method we thought could be utilized is creating informational outlets that shed light on why this issue is not only detrimental toward our migrant brothers and sisters, but also to the Tucson community as a whole. We have highlighted how bilingual informational brochures could be used in our community, but we also discussed that social media outlets and community engagement could be advantageous routes for spreading our messages as well. These brochures would include information on what the current healthcare landscape looks like for undocumented individuals, as well as action items for community members to take to show their support. Additionally, our research indicates that it is also important for audience to have an emotional connection to the issue, which is why we would like to include personal vignettes that share stories of how lack of access to healthcare and fear of accessing healthcare impacts individuals and families. The goals are to improve education and expand care options. By providing information regarding current laws and available resources to the community, we hope to remove some of the stigmas around immigration and provide the community with an understanding of the importance of the issue, as well as how a change could benefit the community as a whole. In addition to our ideas about increasing access to education about this important topic in our local community, we would like to make an impact at the legal level as well. Next steps we considered included establishing connections with legislators and reaching out to media sources about sharing stories and resources with their audience. Additionally, we could participate in town hall meetings and discuss local opinions on healthcare access for undocumented immigrants. Finally, we believe education about the financial benefits for Americans that would result from improved healthcare for immigrants is an important way to increase support for policy change. Here are our references, and here are our group members again. Thank you for listening.